Hello, everybody, and welcome to the show. As I have mentioned to my guest before I hit record today, this topic is too important to only showcase on the Broken Road to Mental Health. So you're also going to hear this on the Doctor Whisperer, because I think that the business of medicine is long and a hard road. And I think that we get a better understanding when we educate our patients, when we educate our colleagues in the industry and those that are not in the industry. Psychiatry and mental health is near and dear to my heart. If you've followed any of the shows, you'll understand that. I won't go into why, but I think that this particular conversation in this time is a vital one. So I would like to welcome to the show Karan Narwal. He is a certified TMS specialist, CEO and director of research at the TMS Advantage practice. And listen, he went to med school. So, and I'm so excited that he's not practicing medicine. I don't care how that sounds, people. We need more people in business that have taken a focus on not just psychiatry and mental health, but also on marketing and understanding business so we can really reach as many patients as possible. So with that, welcome to the show.
Thank you, Sharon. I appreciate you guys having me.
Yes, I'm very excited to have this conversation. So I know what TMS is, and we're going to have a conversation about TMS, but I would like to start this conversation today by explaining to the audience what TMS is.
Sure, absolutely. Transcranial magnetic stimulation is a non-invasive neuromodulation therapy used to treat mental health disorders. And currently we are treating for symptoms to correlate with major depressive disorder, as well as anxiety-based disorders. What TMS does is not what people think sometimes in terms of shock therapy. That's electroconvulsive therapy. That's completely different. What we're doing is using magnetic frequency to modulate neural activity in the brain, so there's more of a communication taking place among certain regions of your brain. When we talk about the logical brain, the emotional brain, and other parts of it as well. But in a long scheme of things, what TMS is trying to do is create an antidepressant effect or an anxiolytic effect and modulate that neurochemical activity. We always say depression is a chemical imbalance, which in actuality it's true, but in reality, mental health disorders are an electrochemical imbalance, if you will. Our brain is this mush of energy that's chemically based and energy based. So by theory, we're using energy, or in this case, magnetic frequency from the powers of magnets to create this level of electrochemical balance and to alleviate a patient's symptoms.
Okay, so this might be a little bit of a challenging conversation that I did not foresee happening. It's this topic of it being a chemical imbalance. So as a sober woman, 27 years, telling my story in 12-step recovery rooms, I started, I always start by telling everybody how I had severe depression in my first year and I was suicidal. And thank goodness that I met a psychiatrist that told me I had a chemical imbalance and then I needed medication in order to relieve my symptoms.
Sure.
And that was true. I'm using bunny ears if you're watching. If you're listening, that's what's happening.
Sure.
And then I never really questioned why, for somebody like me, that I could take that prescribed medication, feel better after 6 months with 12-step recovery, with having a therapist that I was seeing every Tuesday. And I have yet to take anything since that time. I'm 49 today, and that was when I was 21 years old. But I had to incorporate a lot of different modalities in order to lift that depression. So, but that story of the chemical imbalance, I don't necessarily 100% believe that today, because if that's the truth, I would have had to stay on medication. So I certainly didn't expect to have this conversation with you.
Sure.
But I think it's important. I think that because if I believe that story, that I had a chemical imbalance in my brain, I might have thought to stay on medication this entire time.
Right.
And I will admit to you today that it wasn't until I released my book in 2019 and I read Johann Hari's book, The Lost Connections, that a lot of my depression was related to trauma. So maybe we could just touch on that a little bit of why we talk about this chemical imbalance so much.
Absolutely. And first off, Sharon, I just want to say congrats again on your recovery and for what you've done. It's a testament to your will and your strength, and keep doing what you're doing. To touch on the chemical imbalance side of things, let's look at what medications do and to understand what's going on there. And also let's look at what depression and anxiety really is. I always say to all of our patients that come into our office, any mental health disorder, no matter what it is, there's a common theme amongst them, which is the brain is having a lack of processing or a lack of connectivity, if you will. Information is being transferred from one part of your brain to the other through all these neurons, and that information has to be processed. So for example, if somebody has gone through some trauma, if they were in a severe car accident, and every time they've passed by that intersection or location where they've had that accident, there is some sort of response that we start to have some anxiety or panic. That's going to happen again. Irrational thoughts occur, because what ends up happening is your brain starts to send a signal to this anxiety center to say, hey, look, we're in danger. It's fight or flight time. And there's a chemical interaction taking place. We're talking about brain hormones and neurotransmitters, norepinephrine specifically, in some cases, not enough GABA, right? Not enough serotonin or even dopamine. So there's this effect chemically taking place, but also the brain's frequency level, or in this case, activity level is also being changed a bit too. Now, to go back to the chemical imbalance, what ends up happening is, and we look at our brain as a creature of habit. We as humans are creatures of routine. So our brain works the same way. It has associations, it has routines, it has structure. That's why we sleep when it's dark, right? Circadian rhythm is a big part of what we do too, as in terms of being healthy. So along the same lines, the brain tends to make this a new normal. Anxiety becomes a practice routine, and subconsciously we get better and better and better at it. So that chemical imbalance becomes more of a permanent thing, or not, let me rephrase, not permanent, but more of a consistency in your brain in terms of neurotransmitters being up and down or imbalanced in this case. And our brain starts to identify with anxiety as the new normal. That's why when somebody suffers from depression or anxiety or OCD for however many years, and other disorders too, they become better and better at having those symptoms, not intentionally, but their brain has practiced that neurological process again and again and again. And what medications are doing is trying to modulate that through chemical compounds. And the reason people have side effects of medications is because they're chemical compounds. They're affecting the metabolic profile of your body. So now, not only are you trying to change your brain chemistry, your body's chemistry is changing a bit. Side effects from medications that we normally take for depression, such as your Zoloft or Prozac, or even Effexor. What normally happens to some people, they may have some nausea, some headaches. So there's that chemical imbalance taking place physically, but in a mental standpoint too. Now, it's very rare to have somebody say, I'm on Lexapro for 20 years and I feel fantastic. Right? We never really hear that, because once again, our brain gets used to this chemical interaction. Right. It understands that there is this chemical compound taking place that's trying to change the level of neurochemical activity in this place. And we tend to have this sensitivity or acclimation to these medications. And that's why you don't really see people take something for 20 years and feel perfectly fine with it. Our body will eventually desensitize to that medication effect and will need something else. So that imbalance becomes even more of a pathology. So now we're talking about treatment-resistant depression, treatment-resistant anxiety, and that's a whole separate ballgame, because now you're talking about somebody who's not responding to your typical approach of treating somebody with depression and anxiety. So that chemical imbalance furthers and furthers, and now you're talking about somebody who needs to look at some other approaches. Just to touch on therapy, by the way, counseling. When somebody undergoes any type of counseling, whether it's cognitive behavioral therapy or dialectical behavioral therapy, there is a chemical balance taking place with that as well, because you're being given this resource in a cognitive state, being told to apply this perspective. So your brain has to facilitate that connection. So once again, the balance is taking place, or imbalance, if you will. So I hope that answers your question a bit.
Oh, totally. So one of the reasons that I love TMS, and I'm so grateful that we're having this conversation today, is because I do wish that this was something that was in existence when I was suffering, because there was really only, first of all, the internet wasn't around. So that I'm really aging myself, right? So it wasn't like I interview a lot of people today that are sober curious, or, it's like people are getting sober on Instagram today.
Right.
It's right. Or they're getting help for their mental health by
Sure.
using an app. Right. And there's, I'm very open-minded to all of that. I've been practicing on my own journey for so long that I'm so open to whatever helps somebody, right?
Mm-hmm.
But something that is really focused on trying to stay away from the medication. Now, I'm very careful to say that, like, listen, if it wasn't for that Prozac 20 milligrams, I don't know if I'd be here today. If it was placebo or not, it doesn't matter. It worked, right? Yeah. But it also worked because I was seeing a therapist. I was going to 12-step recovery. I was not just taking a pill and thinking, I'm good. I don't have to do any more work. So much work to feel good, right? So the thing I love about TMS is that you're really with the patient, because you're with the patient 5 days a week for 7 to 8 weeks. There's a really thorough consultation happening, a really good understanding of who the person is, what types of medication, what has worked, what has not worked. So you can really have like a patient-centered focus plan, right? So why don't you tell me a little bit about what that looks like for the patient that has been on so many different medications through the years and says, all right, well, I want to know more about TMS. What happens when they come to your office?
Of course. And to touch on what you're saying, just for a moment, there has to be a comprehensive approach in any type of mental health care. Yes. If you say, I'm going to try this app because I'm dealing with something, and try this life coach on Instagram, which, once again, I'm open-minded just like you are about these things, but there has to be a clinical approach. And that's where, TMS really shines, because there's a objective perspective to all of this. So to answer your point, what would normally happen is when a patient comes into our office or requests, information on TMS, we'll have the patient submit information on what exactly, their diagnosis is, medication trials, a little bit of a basic intake, and we'll run insurance benefits too, to make sure there's coverage for them if they're going through insurance. And then there's a consultation with me. And usually at that time, what I do is to screen the patient to see if they're a candidate for TMS, because there are some contraindications, which I'll talk about. But long story short, the patient comes in, we want to see if there's any reasons we can't do treatment, what their history is, to understand what their background is, how long they've been suffering from what they've been suffering from, what have they tried, what has worked, what hasn't worked, and to understand the person a bit more, because, once again, a patient will always be a patient, but there's always a story behind what the patient is bringing to you. And to understand that, I think it requires more of a personal approach. And you're right, patients are with us for 7 to 8 weeks. So when that consultation occurs, we have to know, is this patient going to benefit from TMS, or is something else needed at this time, such as somebody going through some sort of pathology of addiction? As amazing as TMS is, we have to do things in the right order. You can't, go do physical therapy if your arm is still broken and you haven't had surgery, right? So the same approach applies here. If somebody has an addiction history and they're currently abusing substances at that time, we say, let's do rehabilitation first. Let's go to a recovery center first, and then let's talk about TMS. For those patients that are candidates, once they come into our program, we verify everything, make sure everything checks out. I get a basic understanding of what their diagnosis is. And on top of that, I also look at their protocols, which is really important, because the way I describe it is this: the FDA clearance for TMS is for depression. Insurance covers it for depression, but that protocol is not going to work for everybody.
Right.
It's like saying Lexapro will work for all these patients with anxiety and depression. It doesn't work that way.
Right.
So we look at the protocols too. Could we apply something more off-label, such as a low frequency, a different location? So we also look at that. Then once the patient's in the treatment, they're here 5 days a week for a half hour per day for about 6 weeks. Then weeks 7 and 8, we do a basic taper, because you're coming off a quote unquote medication, which is the TMS. We don't want to stop things abruptly, right? And it also gives us a chance to monitor how the patient does during that taper, to see how well they do without TMS. And this requires a lot of due diligence. So when you're with them, like you said, for a half hour per day, you get to know, is this patient interested in writing, music? Just to give you an example, one of our patients, our first year doing this, I still remember, I love talking to this guy. I still catch up with him every now and then. he used to be a writer for a famous TV show. I can't disclose which, but also, loved to play his guitar. And those two things really stuck out. So one thing we made him do was every week was just write a blurb. His depression really limited him from writing anything. So we had him write a couple of things on a notepad. And by week 3 and week 4, those little blurbs and paragraphs became short stories. So we understood, okay, we're working on the behavioral activation side of things. We're pushing him a little bit too, because we got to know him better. On top of it, he's a big, music junkie. So told him to take his guitar out, since he told me how much he loved his guitar. He took it out of his closet, left it in front of his peripheral vision in his home, and eventually about 5 weeks in started playing it again. So these things clinically help us. We do intake, we do measures, we do all these scales, but this type of psychiatric information really speaks volumes. It's what we notate to say, okay, the patient is doing this, this, and this. On top of that, when you're in the program, we offer group therapy. Individual therapy is always recommended, but group therapy is there as a resource. Why? Your brain's starting to make these connections. You're starting to rationalize and logically approach things. You're being more motivated. You want to take advantage of the day. You're having more energy. Let's take full advantage of it. Let's talk about mindfulness. Let's talk about radical acceptance. Let's talk about dietary solutions. We have nutritionists jump into our group sessions every couple of weeks to talk to you guys about food for better mood, less inflammatory diets, healthier eating. Dr. Rizzo, my partner, will jump in once every couple of sessions to talk about medications and what they do and how to approach it with TMS, because these questions are always going to be there. And we figured, what better way to answer these questions than using a communal setting like this on Zoom, which we've done for 4 years now. In addition to that,
I love that. Let me just say that, working with a lot of psychiatrists over the years, sometimes really all they have time for is medication management. And even though they know that if your diet consists of donuts and candy and ice cream, breakfast, lunch, and dinner, sounds good, right? And then you're taking this medication, it's difficult. And a lot of people don't really understand how much nutrition and mindfulness and exercise benefit. And I do think that there needs to be more of a whole body approach versus just, because you're not, as much as you're treating the depression or treating the anxiety or treating the OCD, there's so much more going on. And I know that before we hit record today, we were just talking about, the world that we're living in today.
Sure.
And when I ask all the psychiatrists and mental health healers that I work with, what is the biggest complaint? What is the biggest? And everybody says anxiety across the board. So 100%. Do you treat anxiety is my first question. And then what does that look like with TMS?
Sure. Well, to answer your question, yes, we do treat anxiety. As far as how it looks, it's a different protocol. And what that really means is, I'll kind of put it in layman terms. If we talk about depression, or we're talking about bipolar depression, and depression overall, think of the Latin prefix of the word depression. It means slow. If something has a depressant effect, it slows your brain down. Marijuana is a depressant. Alcohol is a depressant, right? So when somebody has anxiety, we're talking about a very fast brain. So to keep it simple, your brain's working way too fast, aka anxiety, OCD, in some cases PTSD, in some cases panic disorder, ADHD, or it's working way too slow, aka depression. So from that perspective, if we look at what's happening in terms of activity in the brain, we're using TMS to complement the effects of what's not taking place. So if we're trying to treat depression, we want to increase the activity of the brain in terms of neurons communicating. I always tell patients, it's like, look at 275, the interstate we have here in Tampa Bay. If it's like 4 cars going 40 miles an hour, that's depression. Those cars are your neurotransmitters. There's not enough of that traffic, not enough speed of that traffic. Whereas anxiety is 275 with 1,000 cars going 100 miles an hour, which is kind of how it feels every day. But my point is, that the traffic is very inconsistent. There's an imbalance of that traffic. So to answer your point again, with TMS, we're trying to create this stabilizing effect or slow things down. The frequency is a little lower. It's 1 hertz frequency. It's repetitive. It's 1 pulse per second, and it has a very mood stabilizing effect. I always describe our anxiety protocol as kind of like your Xanax or lithium. It has a very mood stabilizing effect where it slows things down. Whereas our left side treatment for depression, which is a standard protocol for depression, which is in that left frontal area, that's a higher frequency. That's 10 hertz. That's very activating. And I always describe that to be more like your stimulants, like your Adderall or your Lexapros, to be specific. So if that answers your question.
Yeah, totally. And I'm thinking about, I hope there's a person out there listening to me that is going to see their primary care doctor for their depression or their anxiety, that this is nothing against primary care doctors. I just know that it is such a specialized modality. It's such a specialized thing, mental health. And it has so many there's so many variables, right? So I can, in my mind, I'm thinking of 5 people right now that I know that go to see their primary care. They say they have anxiety. They give them a pill.
Yeah.
They go, or, it's medical marijuana, or I really think that if we would take the time, if mental health is a bitch, right? Like this is no joke. This is everything, right? What's happening in our lives, right? It is everything. It gets you out of bed. It will get you to work or not get you to work. It will get you to show up for that party that you were invited to that you don't want to go to. This is a lot of work.
Sure.
So we really have to, if we really want to get better, right? We're going to have to spend the time with the specialists that understand how complex this really is. Right?
100%.
Can you feel me?
I can feel you, Sharon. I will say, you know what, to touch on what you're saying, I can't tell you how many times when I go on LinkedIn or any networking events that I'm starting to meet these individuals called life coaches. And I'm not against that profession. Don't get me wrong.
Either.
But
especially when they're 21. I'm kidding.
Correct. Well, here's the thing. When you're in your 20s, you're feeling great, right? Like your whole life's ahead of you. Everything is positive. I understand that. But with that being said, you mentioned primary care. You mentioned other avenues of intervention, medical marijuana. I put life coaching in the same regard. You're trying these different resources to not really treat the root cause of what's going on, but to kind of maintain your symptoms. And a primary care physician or provider will look at you and say, okay, you have anxiety. You know what? Let's give you some Zoloft or Prozac or even a benzodiazepine like a Xanax or a Klonopin. Okay. Well, first off, has that patient been psychiatrically assessed? Is there underlying trauma? Is there a medical cause or concern? Which is why primary care physicians are the first point of intervention, because they should look at, which they do, is vitamin D deficient or thyroid levels imbalanced, right? We have to understand, first and foremost, is there a medical reason as to why the person's feeling this way? And if we can rule everything out there, okay, now let's work on the brain. There clearly is something pathological happening neurologically speaking, and let's address that. Now, the one thing I will say, once again, we live in a world of instant gratification. We want results. I thank Amazon for this, the 2-day shipping method, right? So
yes,
I have patients, right? Exactly. I have patients come in and say, I'm treatment for 4 days now. I'm not feeling better. I'm like, because it's a process. Healing takes time. Yes. And even the medication process takes time. Yeah. You cannot meet with somebody 3-4 times and expect to have life-changing results. Yeah. You have to commit to something. And more importantly, think about how long you've suffered from whatever mental health disorder you have. 90% of our patients come in here, they've had anxiety and depression for more than 12 months on average. So if they've had that,
I like it.
Correct, exactly. So if your brain has subconsciously practiced being depressed and gotten better at it for a decade or whatever, however many years, it takes time to change that course of activity. And more importantly, it takes a lot of due diligence, meeting with a provider, whether it's a psychiatrist or nurse practitioner or medical physician assistant, whether it's meeting with a counselor working on specific therapy. If you suffer from PTSD, have a counselor talk to you about things like EMDR, which are very trauma-based therapies. Yes. That's what we really encourage to our patients. I've had patients come in here with severe PTSD. We've done TMS. They've had a 50% reduction in symptoms, but they're like, I'm still feeling kind of like I can improve. And I'm like, great. That's where therapy comes in. It's a next step approach. And that's how it should be. Same with primary care. There should be a referral process. There should be a system in place. And I will say with a lot of gratitude, the American Psychiatric Association is adapting these types of systems for the future as recommendations. They are understanding, they do see what's going on, and they're aware of what we can do differently.
Yeah, it's amazing. So I work with a psychiatrist that's alternative, that offers other modalities. You know, he has a massage therapist that works with trauma. He has a psychologist on board, and all of that is so helpful because it is a lot of work. It's never just one thing, and it's hard for people to understand that. And the reason that I brought up the primary care thing too is because people especially people that are not in the medical industry, that don't really understand the difference between even the specialties. How many people have said, psychiatrist, psychology, it's the same thing? Well, it's totally different.
Correct.
Right?
Correct.
Well, I hear it all the time. I'm going to see my psychologist to get my medication. I'm like, well, that's impossible. Okay. Right. So I really think it's so important that people understand, especially the medical industry, hence why this will be on the Dr. Whisperer show as well, is that if you tell somebody that has depression, anxiety, OCD, that they are anxious, or that they have ADHD, they're going to take that. Of course, they're going to go, well, that must be right because you're my doctor.
Correct.
And I think that it's high time that, especially in primary care, that we take an understanding of how important it is when it comes to mental health, that we're referring to the right collaborators. Just like you said, if somebody comes in and they are suffering with addiction or alcoholism, you're not going to throw them into TMS right away. You're going to send them out to either a detox or a rehab facility and get them the help they need. And then maybe they'll come back after that, because like me, they'll suffer from depression because they realize that, oh, shoot, I don't have alcohol or drugs anymore to deal with what I had. Right. Now I have to find other resources. So I'm really glad that you have this sister company of Advantage Mental Health. Can you briefly just mention what that is?
Sure. So with TMS Advantage, our office here in Clearwater and our second office in St. Pete, the office in Clearwater is attached to Advantage Mental Health. So it's one building, two offices. Mm-hmm. And the reason we've set it up this way is merely for the fact that we want to have some comprehensive care. So we have two therapists, two nurse practitioners, actually hiring a third therapist as we speak, and Dr. Rizzo, my partner, who is on that side of the practice as well as a licensed psychiatrist. The reason we've incorporated this facet of what we do is because there has to be some follow-up psychiatric care, or vertically integrated psychiatry, as we call it. So you're having a medication discussion pre and post TMS. You're having, whether it's a nurse practitioner or a psychiatrist. In addition to that, the staff, we do weekly staff meetings on our patients. So every week we talk about different cases. Okay, how is this patient doing with you? Great. What are they working on with counseling? Awesome. Is the medication being adjusted? That explains why they're feeling this way. So on our end, we don't have to go through this release of records to contact other provider. We can do it in-house and really be on top of our patients' psychiatric care, which I think is important. And touch on something you just mentioned about diagnosis. When a patient's diagnosed, they feel that label is on them
forever.
And I have to remind the general public, that does not mean that is who you are.
Amen, brother.
It's what you're feeling. If someone says, I'm anxious, no, you are feeling anxious. That is not who you are. And people, and listen, physicians are humans. Nurse practitioners are humans too. Therapists are humans. We make mistakes. Yes. We may see something differently. One provider may say, I see bipolar. One provider may say, I see PTSD. And what ends up happening is, and I can't tell you how many times I've seen this, the patient will say, yeah, I was told I had bipolar, and I guess I do, but I was also told I had PTSD, and I don't know if that makes sense. And I'm like, let's just wipe the slate clean for a second. Yeah. So, so Advantage Mental Health, that's one of our goals, is to keep things comprehensive and make sure we can focus on objective care even after TMS or even before as well.
Right. I mean, it's so interesting because the 2019, when I put the book out, I haven't suffered from depression, clinical depression, since I was 21. Mm-hmm. But there are only two things that I'm scared of in the world. Number one is depression.
Sure.
Number two, now that I live in Florida, are hurricanes. Okay. So I'm so mindful of that it is my practice, my daily practice, to prevent ever going back to how I felt. So I will do whatever it takes. I will have a background that looks like a forest. I will, go out in nature. I will run. I will exercise. I will eat right, because all of this is important. It is not just one thing. I think we've said that enough today.
100%.
But I really, whatever story that you tell yourself will take energy out from your mouth. So if you are telling yourself that story every day, that this is who you are and this is why you act that way, I promise you, that's how you are going to be for life. Yep. And I think that it's very important knowing that you have a more holistic, a more treating the whole person approach. You're not just here to, TMS pushers.
That's the goal. Yeah.
The goal is for patient care.
Yeah, 100%.
Patient care.
Quality over quantity. That's how anything in life should be approached, no matter what you're doing, whether it's buying lunch or making a decision on buying a home, right? I think you look at it from any perspective. If your approach has always been about the quality perspective, especially when it comes to your health, physical and mental, then you'll do what's right for yourself and for those that you love.
So for all of you who were not privy to the conversation that we had before I hit record today, you should all feel good knowing that this gentleman that I've been speaking to for the last half hour has a great passion for people getting better. And I think that that's one of the things that we might be lacking today, that there's no passion behind the service that is being provided in the healthcare industry. So I'm always happy to promote anybody that is interested in really making a difference and really making an impact, especially today in the world that we're living in. We need more advocates and more providers to really take a stance and treat patients the way they deserve to be treated. It's no longer a treat 'em and street 'em mentality. That's actually a bad one, right?
I appreciate that, Sharon. Thank you.
So thank you so much for being here today.
No problem. I just wanted to let you know, we also do publish research. We are part of Clinical TMS Society. So if anybody's interested in learning more about our research, we do have some of our data on our website, and we will have more research coming out this year. So we are eager to publish and share our studies and what we're seeing on our end. And that's where the passion really comes in. So I thank you for saying that, and I really appreciate this opportunity, Sharon. It's wonderful.
Yeah, and all of the information to get to the published information is going to be on our show notes, so be sure to click and do your homework, people. Do your homework. Don't tell that story of what that one primary care told you about yourself. Thanks, everybody.
Thank you.
So don't forget, if you mention that you've seen the show or listened to it on the podcast, mention Thai Technology, and you will get 3 months for free.